The language of anatomy. Most of us are naturally curious about our bodies. This fact is amply demonstrated by infants who are fascinated with their own waving hands or their mother's nose. Unlike the infant, however, an anatomy student must learn to identify body structures formally. For today's lesson, our objectives are: we have describe the anatomical position verbally or by demonstrating it. And second, demonstrate proficiency in using terms describing body landmarks, directions, planes, and surfaces. The word anatomy came from the Greek word ana means apart and tome means to cut. So anatomy is the branch of science concerned with the bodily structure of humans, animals, and other living organisms, especially as revealed by dissection and the separation of parts. So we have here an example of anatomical position. So when we say anatomical position, this is a reference position that allows for the use of consistent directional terminology. So all descriptions of locations are made from within anatomical position. So the subject is facing forward, as you can see, with palms forward, thumbs facing to the sides. This is the position from which all directions and descriptions are made. The person is standing erect, palms facing anteriorly, feet together, and facing forward. So we have special terminology used to prevent misunderstanding. So we have here the terms used for position, for direction, regions, and structures. Now let's start with the orientation and directional terms. So we have here the terms, the definition, the illustration, and the example. Now let's start with the superior or the cranial or cephalad. Cephalad. So when we say superior, toward the head end or upper part of a structure or the body. In short, superior means above. Superior means above. Now we have here an example, illustration. And an example is our forehead or the forehead is superior to the nose. So the forehead is above to the nose. The second one is opposite of the superior, which is inferior. So inferior means caudal, away from the head end or toward the lower part of the structure of the body. So inferior means below. So example, the navel is inferior to the breastbone, or the navel is below to the breastbone. The next one is anterior or ventral. So this means toward or at the front of the body or in front of. Example, the breastbone is anterior to the spine. So when we say anterior, in front of, it is also known as the ventral part. So opposite of anterior is we have the posterior or the dorsal part. Now, so the toward or at the back side of the body. Posterior means behind. Example, the heart is posterior to the breastbone. Then we have also the term medial. Medial, toward or at the midline of the body, on the inner side of. So medial, middle. Example, the heart is medial to the arm. Now, take note, ventral and anterior are synonymous in humans. This is not the case in a four-legged animals. Now, ventral refers to the belly of an animal and thus is the inferior surface of the four-legged animals. Likewise, although the dorsal and the posterior surfaces are the same in humans, so the term dorsal refers to an animal's back. So thus, the dorsal surface of the four-legged animals is their superior surface. Another term is we have the term lateral. Okay, lateral means away from the midline of the body, on the outer side of. Okay, lateral, away from the midline. Example, the arms are lateral to the chest. The arms are lateral, okay, means away from the midline. Another one, we have the intermediate. So, between or more medial and a more lateral structure. Between a more medial and a more lateral structure. Example, the armpit is intermediate between the breastbone and shoulder. Okay? Proximal. So, proximal means close to the origin of the body part or the point of attachment of a limb to the body trunk. Close to the origin of the body part. Now, example, the elbow is proximal to the wrist. So, meaning that the elbow is closer to the shoulder or attachment point of the arm than the wrist. Okay, opposite of the proximal is we have the distal. Farther from the origin of the body part or the point of attachment of the limb to the body trunk. Okay? So, example, the knee is distal to the thigh, away from, farther from the origin of the body part. Superficial. Superficial, toward or at the body surface. So, the skin is superficial to the skeleton. Okay, it is just found toward or at the body surface. Deep. So, deep, away from the body surface, more internal. So, let's say the lungs are dipped to the rib cage. So, it is more on the internal part. So, here are the terms. Okay, lateral, away from the midline, intermediate between a more medial and a more lateral structure. Proximal means close to the origin of the body. Distal means away or farther from the origin of the body part. Superficial means toward or at the body surface, and deep, away from the body surface or more internal. So we have here an example of body landmarks. Now, body landmarks, again, when we say anterior, the front part, okay? The front part of the body. So we have the nasal. So when we say nasal, we are referring to the nose. Okay, nasal or nose. Another one, oral. Oral means mouth. Okay, cervical. Cervical means the neck region. Cervical. This one is the neck region. Then the acromial is we have here the shoulder blade or the shoulder part. The thoracic, okay, the chest. The thoracic or the chest. We have the brachial or the arm. Okay, the brachial or the arm. Okay, we have the umbilical. Okay, umbilical. We have the navel part. We have the carpal. Okay, carpal or the wrist part. The digital. Okay, when we say digital, we're talking to the fingers or toes. Orbital. Okay, orbital actually is the bony eye socket. Okay, bony eye socket. We have the buccal or the cheek. We have the sternal or the region of the breastbone. We have the axillary or our armpit. We have the antecubital. Okay. Antecubital means anterior surface of the elbow. Okay, anterior surface of the elbow. We have the abdominal, anterior body trunk, region inferior to the ribs. Okay, this one is our abdominal part. We have the pelvic or the pelvic region. Coxal means hip. Okay, our hip. Then we have the inguinal. Okay, the inguinal here is the groin. Okay. Pubic is actually the genital region. Okay. Then we have the patellar or the kneecap. Okay. We have the crural or the leg. We have the tarsal or the ankle. We have the femoral or the thigh. And we have the fibular side of the leg. Okay, so these are the parts for the anterior body landmarks. The next one is the posterior part. So the posterior part includes, we have the cephalic region. So when we say cephalic, means we're talking to the head. Okay, head. Occipital. Occipital means the base of the skull. Okay, the base of the skull. Okay, the deltoid part, the muscle part. Okay, the scapular, shoulder muscle part. The scapular means the scapula. The vertebral area of the spinal column. This one is the area of the spinal column. We have the lumbar. Lumbar area of the back between the ribs and the hips. Okay. Then when we say the sacral, we have here the area between the hips. Then gluteal or the buttocks. Okay. Then we have the popliteal. Okay. Popliteal means back of the knee. Then we have the sural, posterior surface of the leg. Okay. Posterior surface of the leg. So before we will proceed with our next discussion, I would like you to have a simple activity about this one. Okay, we have here a simple activity about orientation and directional terms. Kindly answer this one in your Google Classroom. So number 1, the sternum is blank to the vertebrae. Number 2, the orbit is blank to the oral cavity. Number 3, the heart is blank to the lungs. Number 4, the eyes are blank to the nose. Number 5, the skin is blank to the bones. And number 6, the elbow is blank to the wrist. Okay, don't forget to answer this one in your Google Classroom. Okay, our next lesson is all about the body planes. So we have here the median, the frontal, and the transverse. Okay, let's start with the frontal plane or the coronal plane. So this one, the coronal or the frontal plane is a vertical plane running from side to side. Okay, vertical plane running from side to side divides the body or any of its parts into anterior and posterior. So as you can see, we are actually dividing the body into anterior and posterior. So this is what we call the frontal or the coronal plane. The second one is we have the sagittal. Okay, the median, the mid-sagittal. So the median means middle. Okay, we are actually a vertical running from front to back divides the body or any of its parts into right and left. Okay, right and left. So, if it's front and back, dividing the body into front and back, this one is frontal or coronal. But if we're just cutting the body, let's say dividing the part into right and left, if it's equal, left and right, that's mid-sagittal. Okay, but if it's, let's say, more left and more left or more right, that's parasagittal. So the third one is transverse. Okay, transverse divides the body or any of its part into upper and lower part. Okay, this one is a transverse cut. We have the upper part of the body, which is the superior and the inferior, upper and lower. If we're dividing the body into front and back, that's frontal or coronal. And if it's dividing the body into right and left, that is what we call the median plane. Next is we have the body cavities. Now the body cavities or the cavities or spaces of the body contain the internal organs or the viscera. So the two main cavities are called the ventral, okay, the ventral cavity, and we have the other one is the dorsal cavity. So the ventral is the larger cavity and is subdivided into two parts. Okay, we have the thoracic and we have the abdominopelvic. So abdominal cavity and the pelvic cavity. So which is divided, okay, subdivided into two parts, the thoracic, okay, again, the ventral, the thoracic, and the abdominopelvic cavity, okay, by the diaphragm, divided by the diaphragm, which is a dome-shaped respiratory muscle. So the thoracic cavity, the upper ventral thoracic or the chest cavity, contains the heart. Okay, so in the thoracic part, we can see the heart, the lungs, the trachea, the esophagus, the large blood vessels, and nerves. So the thoracic cavity is bound laterally by the ribs, covered by the pleura and the diaphragm caudally. Now, how about the abdominopelvic cavity, which consists of the abdominal cavity and the pelvic cavity? So the lower part of the ventral cavity can be further divided into two portions. Okay, we have the abdominal cavity and we have the pelvic cavity. So the abdominal cavity contains most of the gastrointestinal tract. Okay, so as well as kidneys and adrenal glands. So the abdominal cavity is bound cranially by the diaphragm, laterally by the body wall, and caudally by the pelvic cavity. So the pelvic cavity, okay, contains most of the urogenital system as well as the rectum. Okay, how about the dorsal body cavity? So the dorsal, it contains organs lying more posterior in the body. Okay, posterior in the body. So the dorsal cavity can be divided into two portions. We have the cranial cavity, okay, which houses the brain. The cranial cavity houses the brain, and the lower portion of the vertebral canal, okay, vertebral canal houses the spinal cord. Okay. Next is we have the abdominopelvic quadrants. Okay, abdominopelvic quadrants. So we have actually 4 quadrants. We have the left upper quadrant, the right upper quadrant, we have the left lower quadrant, and the right lower quadrant. Now, let's start with the left upper quadrant. So here, in the left upper quadrants, we can see liver, okay, longer portions of the stomach. We have the pancreas, the left kidney, the spleen, the portions of the transverse and descending colon, and parts of the small intestine. So those are part of the left upper quadrants. Now for the right upper quadrant, okay, we have here the right upper quadrant contains the right portion of the liver. We have the gallbladder, the right kidney. We have the small portions of the stomach, portions of the ascending and transverse colon, and parts of the small intestine. For the left lower quadrant, okay, houses the majority of the small intestine, some of the large intestine, the left female reproductive organs, and the left ureter. For the right lower quadrant, okay, this right lower quadrant sits the cecum. Okay, we have the appendix, part of the small intestines, the right female reproductive organs, and the right ureter. Okay, let's continue. We have also here the abdominopelvic regions. So what are those 9 regions? We have actually 9 regions. Now, number 1, we have the hypochondriac. Okay, the hypochondriac region, the right and the left hypochondriac. Now, these 2 upper right and left regions below the cartilage of the ribs that extend over the abdomen. Okay. The second one, we have the epigastric region here. So the epigastric region is the region above the stomach. Okay. Next, we have the lumbar. Okay, the lumbar, we have the right lumbar and the left lumbar. So these 2 middle right and left regions near the waist. Okay, near the waist. Next one is we have the umbilical region. So the umbilical region of the navel or the umbilicus. Okay, region of the navel or umbilicus. Next is we have the inguinal. Okay, inguinal, the 2 right and left regions. Okay, near the groin, which is the area where the two legs join the trunk of the body. Okay, the right and the left. Here, the right iliac and the left iliac region, or the inguinal. Then, another one, the last one is we have the hypogastric. Okay, hypogastric region. So, the hypogastric region is the lower middle region below the umbilical region. So, I hope that our lesson today, you learned something new about the language of anatomy. Okay, thank you. And don't forget to like, share, and subscribe to my channel.